In the country suffering the world's worst humanitarian crisis, the last thing it needs is clinics closing at an alarming rate. But in Yemen, that's precisely what's happening. 80% of the population in the war-torn country are reliant on aid. But there's an acute funding shortage for health, sanitation and nutrition services that stop millions from starving. In the Marhaba displacement camp in Hajjar province, resident Fateh Jaiba keeps checking if her local clinic has reopened.
My son is sick with shortness of breath. The clinic is closed. We used to make use of it. People with emergency cases used to benefit from it. The sick, old and young. We live in an unstable situation and we want a working hospital.
The United Nations said last week 12 of its 38 major programmes have shut or been scaled down. And between August and September, 20 programmes face further reductions or closure. Ahmed Mansour and his colleagues went 8 months without pay, but this month they closed their doors to their patients.
We've made sacrifices for the displaced. We had intended to go on strike, but it was our humanity that forced us to come back in April. We've been working through April, May, June and July because of our humanity. God writes in his holy book that no soul is expected to do more than it can. So we did what we could.
Yemen's economy and health system has been devastated by 5 years of war that has killed more than 100,000 people. Many healthcare workers and other public servants have not been paid for as much as 3 years. Aid agencies tried to keep critical services ticking over with small incentive payments to staff, but even that support is now crumbling as funds run dry.